All right, everyone, I'm gonna take you behind the scenes and I'm gonna show you how I evaluate patients ahead of surgery. You're gonna see the surgical markings and the planning. You're gonna find it fascinating, and make sure you stay tuned through the end because you're gonna see a beautiful transformation from beginning to end. Hi everyone, I'm Dr. Karam, board certified facial plastic surgeon and founder and creator of KaramMD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And today I'm going to share with you how I match up the specific types of procedures that we do with the conditions and issues that are going along. So I'm going to introduce you to our beautiful patient. Her name is Laura. She's from the Boston area. She came down to see me for surgery. She's a year and a half out. She's 66 years old. And I just happened to see her. She just was in San Diego. She popped into the office, so it was a beautiful opportunity to have a little post-operative interview with her as well, which you're gonna find to be very informative in terms of how she's been feeling over the last year and a half, and just how she experienced the entire process. So without further ado, let's break it down. Let's take a look at Laura's pre-surgical front view. And the front view is a very important view because what it tells us is what's the shape of the face, what has happened as a result of aging. So one of the things that really bothered Laura was this bunching of the skin around the mouth. This area right here, as you can see, kind of is like an accordion-like effect that as the skin begins to drift downward, it starts to coalesce or sort of build up around the mouth. And you can see that as a way of a marionette fold down and through here. But some other important aspects, if you look at the corners of the brow, for example, you'll see that the corners of the brow have shifted downward, the mid-face is coming down, and then underneath the neck, because nothing is holding her neck up anymore because this entire soft tissue platform has drifted down, what you start to see is sort of this filling in of excess muscle and fat underneath her chin. This area is something that, as we age, happens not only because of muscle laxity that is born from the face not holding the neck up anymore, but it's also, as we age, a lot of people start to build a little bit of fat under their neck. And not everyone ages this way, but in case of Laura, she's got a little bit of fullness built up in here as well as laxity. And you're gonna really appreciate the laxity on the other views. Some other really interesting and important points is, as you can see here, Laura's got some excess skin around her upper eyelids. And what you don't totally appreciate on the photograph, but you can really tell once we lift her cheeks, is that she actually has the same thing going on with her lower eyelids. Now, the volume aspects of facial aging are equally as important as the laxity aspects. And when you look at what is happening to Laura's face, it's literally the same kind of pattern that happens to all of us as we age. We lose a little bit of volume in the temporal area. We lose some volume in the upper eyelid area. We also lose volume down around the lower eyelid region. And then we also lose volume around this pre-jowl, or this area underneath the lip. And then of course we lose some volume in the actual lips. These areas all deflate. What I didn't say here, and I think it's really important to point out, is she didn't lose any volume in her cheek. And remember, where people usually go in and put fillers and things like that is actually in the cheek. But in every case, majority of cases I should say, you haven't actually lost volume in the cheek. The problem is that the cheek begins to descend downward, so it empties the mid-face and it makes it look like you have. So the true remedy is not to fill that area, but to lift it. And that's one of the things that I'm going to be kind of addressing in a very, very specific way. Now we're going to evaluate her skin. And one of the things that you can see is that she's got these vertical lines that have formed around the mouth. A lot of times these are termed as smoking lines, but they're, in Laura's case, they have nothing to do with smoking. It's just that you lose the collagen, you lose the elasticity, and as a result, the lines start to form in this vertical direction. This isn't something that surgery will correct. In fact, this is something that you would correct with laser resurfacing or even Botox. Overall condition of the skin is the next thing we look at. Skin, as it ages, it begins to lose some of its vitality, its brightness, and that's what we see here. There's issues related to some pigmentation up and through here, and also that brightness of the skin has diminished also because of building up of dead tissue on the surface of the skin. So that is one of the most underrated and undertreated areas when you're doing this type of rejuvenation, is addressing the skin in addition to the shape that we're talking about here with the surgeries that we're going to suggest and recommend here. So keep an eye on the skin, because both of those things are critical for making somebody fundamentally look as young as they feel. All right, so this view is called the 3/4 view. This is probably one of the most helpful views in terms of determining what's going on with the face. Now, when we look at Laura, we were talking about this descending corner of the brow. You can see the skin starts to bunch up in the outer area of the eye. You see the mid-face drifting downward. You see the cheeks drifting down and kind of building up around the cheek area with these little lines that form in this area, and also the presence of jowling, which is basically the cheek falling over the mandibular region, and then of course kind of this excess stuff going on underneath her chin. And when we're showing on the front view a moment ago, you can see that there's deflation really clearly visible in this area. There's loss of volume in here in terms of shadowing. The lips have lost some fullness, and this whole area kind of emptied out. Right? And then when we talked about the skin changes, you can really appreciate what's happening here with the overall skin condition in the cheeks and the forehead and just overall. So now let's look at our profile view, because again, this is going to be the view that you're going to really be able to tell what's happening with the shape of her neck. All right, so now we're looking at our profile view, which profile view gives us a good understanding of the two-dimensional shape of the neck as well as the midface. So you can see that there's a little bit of a bulge in her lower eyelid area. There is also a increased length between her eyelid and her cheek. And you'll really appreciate this in the after photo. This is called the eyelid cheek junction. It elongates, but you can really see the presence of jowling here. And then also, you know, if you think about a youthful neck, it's more or less shaped, you know, like a 90 degrees. You know, it's taken this type of configuration. But in Laura's case, you can see the angle is effectively obtuse. It's lost its angle and shape. And that's really an important thing to establish that from a two-dimensional, because that informs us of the need to do neck work or, you know, any type of under the chin work related to either excess fat or excess muscle. And remember, the neck doesn't age in the exact same way in every single person. Some people lose the support of the neck, so therefore the muscles start to sag and you get the kind of droopy turkey waddler kind of an effect. And then other people literally get this kind of bulge of fat underneath their neck. And in Laura's case, she's got a little bit of both. So having had the opportunity to do a full evaluation of Laura preoperatively, the recommendations that I came up with for her to address her facial aging changes in a comprehensive way, and I'm going to explain in a moment why comprehensive is so important. The changes that happen with the face are not limited to one or two areas. You got to think about it in the context of anything that ages, right? Whether it's your, for example, a home kitchen that was built in the 1950s. You've got, you know, walls and appliances and countertops and flooring and ceilings and light fixtures and all these other things that are basically from that era. Then you go to remodel it, and you're not going to leave certain areas untouched, because once you walk into that kitchen and there's flooring and appliances from from 50 years ago next to more modern countertops and appliances and fixtures, etc., it's going to look odd. There's a disconnect between these things, and that's what happens with facial aging. Also, is that it ages in totality. You start to change all the things that we just showed here, and the remedy for those things need to be done in a comprehensive way if you want the face to look harmonious and balanced, and most importantly, to look like it's never had any work done whatsoever, because for anyone who ever gets these type of surgeries, they want to look natural and they want to look like themselves. In Laura's case, I recommended for her to have a vertical restore, which is going to address the laxity of her corners of her brow, mid-face, jawline, and neck in one procedure. So the vertical restore is like basically 4 procedures in one. So that takes care of all the laxity related to her fascia. Then what we do in almost 99% of the cases is we want to restore the volume. So we perform a fat transfer and address all the areas that I've marked here that show the loss of volume. We're going to replace those areas with a little bit of fat transfer. And fat transfer is better, in my opinion, compared to fillers because A, it's natural and it's permanent. And if you do it in a very delicate and appropriate way, it never looks overfilled or done or any of those issues that you get sometimes with overfilling. The third element is treating her skin. And this is so important because what makes a person look young is young-looking skin in addition to a young-looking facial shape. The surgery addresses her shape. The skin is addressed with what you do on a regular basis to restore skin. Now, in Laura's case, she's been on the trifecta since surgery, and I can't remember exactly, maybe she was even on it slightly before surgery, but she's been on it consistently for that period of time after surgery. And you will see in her postoperative photographs, as well as the interview when we talk about it a little bit, what a difference her skin has made as a result of being on the trifecta consistently for that period of time, which is really, really important. So let's take a close look at the eyes. I want to spend a few minutes here just to explain how I address the eyes in these situations. So in a closer view, you can see this excess skin in this area, right? And in the closer view, you can actually really see that there's excess skin here, but there's also this kind of puffiness, and you can appreciate that by looking at this kind of discoloration right in here. But this puffiness and this excess skin, in addition to the fact that there is hollowing up and through here, as well as hollowing along the eyelid and temple, this whole area right here, we call it the periorbital region. And my approach with this is usually an upper blepharoplasty to remove the excess skin. That simply is an incision in the natural crease and removal of the excess skin. Very, very deliberate not to change the shape of the eye. That's so, so important because no one wants the essence of their appearance to change. And on the lower eyelid, if you have a fat pad, we're gonna remove the puffiness through an incision on the inside of the eyelid. That's called a transconjunctival lower blepharoplasty. I remove the fat out of there. And then for the excess skin, I'm gonna perform a skin pinch, which is just basically a little incision that's made underneath the eyelid, and the excess skin is pinched up and removed. And then with the fat transfer, obviously this is gonna be treated differently, but at the same time is we're gonna place some fat in these areas where the volume has begun to diminish, so that what you see when you look at the eyes is a more refreshed looking eye, and an eye effectively doesn't change anything about the look of it. It doesn't look like because there are some procedures that change the angles of the eye, that narrow the eye, that try to widen the eye. There's all these different things. But a procedure like this, where we're literally just removing the excess tissue that has formed as a result of aging and replacing some of the lost volume that has happened, leaves the eyes looking like they used to without any change. So now let's take a look at her after photos, and I'll show you some of the changes. All right, so now let's take a look at the before and afters. So we're gonna start with the front view. There's been a global change to the overall aging changes of her face. There's a balance, there's a harmony. The portions of her face look like they belong together, but that's because of that comprehensive approach that we've taken. So what we did here, and you can see in her after photo, is we lifted her lateral brows, and as a result, this hooding in this area is gone. And we lifted the lateral brows as part of the vertical restore. That's one of the unique things about the vertical restore. It actually lifts this area together. We remove that extra skin in her upper eyelid with an upper blepharoplasty. So when you compare how heavy this area is in the preoperative portion, you see, wow, what a difference in her eyes. They look so soft and natural and refreshed. And then we took out the fat pad underneath her eyes, took out the extra skin, and what you can see here is this eyelid cheek junction, which is really, really important, has been significantly shortened. Right? That's a big part of looking refreshed and looking young, is not having a long distance between your eyelid and your cheek. It's an underrated part of facial rejuvenation that you don't hear talked about a lot, but it's a critical part of it. And then when you look at the overall shape of the face, all of this has been lifted. This excess soft tissue in this area has been significantly improved. Now, remember, she still has smile lines, which are normal part of the face. That's just how the face creases every time you smile. But all of this excess stuff in this area has significantly improved. And then when you look at underneath her neck, that heaviness is literally gone. The shape of the face is take on a much more oval or heart shape to it, because when you look at the overall shape to it, it's again looking more like a heart, as opposed to before it kind of indents here, goes down more square. It just has a totally different vibe to it. And that architecture, that structure of the face is so important when it comes to looking young. You can tell that from when you look at somebody from across the street. You don't even have to get close to them. It's all about the shape. The areas of volume, which you can see are so much softer in this area here this area here. The mouth looks a lot softer. This area here around the chin area looks a lot softer, does not look like it's depressed or deflated. And ultimately, as you can see, her skin looks brighter and better from the years of being on the trifecta. As I said before, the three-quarter view is one of the most high impact and most visually telling aspects of facial evaluation. You can see when you look at her three-quarter view here, those jowls are gone. She has a nice straight jawline now. The mid-face is no longer kind of sagging down. You can see it has a good light reflex up here. The corners of the brow have been elevated. And ultimately, there's just a softness and a youthfulness as this face has been repositioned, but also reinflated back into position. Looking at her profile view, this angle of her neck due to excess soft tissue as well as laxity has been repositioned. She's much more angular under her neck. She's not as full at this area. And remember, there's a limitation to how far this can go back, and that's related to where your natural airway is. Now, I always think of Angelina Jolie, for example. She's got one of the most long mandibles and a neck that's perfectly 90 degrees. But one of the interesting things is that people cannot necessarily achieve that if they don't have the anatomy for it. All we can do as surgeons is clear the excess laxity as well as the excess fat, but our end point is going to be where you feel the airway. So if you feel into yourself and you feel, oh, there's a, I can feel my airway right here, well, that's as far as we can go. People who have that type of neck where it's like a perfectly 90 degrees, if you feel them, their airway is tucked way further back. We call it a posterior airway, and so as a result, you can really push this soft tissue as far back as the airway or the voice box. In addition, there are no more jowls along the jawline. It's a nice crisp look in through here. And this is one of the things that I love to see. You can see in the profile view how crowded her corner of the brow is. And here you can see it's just nice and soft. That eyelid cheek junction again is significantly shorter than it was before, as well as that little puffiness under her eye is gone, and she looks just nice and smooth. And then her incisions, which live along here, you can see are hardly noticeable, and I'm just going to redo that so you can tell the entire ear anatomy as well as the hairline anatomy has remained beautifully intact. So there's nothing about her that screams, I've been altered or have had facelift. This is such an important part of the overall undetectability of a surgical outcome. All right, so now let's listen to Laura as she and I sat down together. Like I said, she just happened to be in the neighborhood and she popped in, and I was in between surgery, so I got a chance to sit down with her and go over all this. And I think her story and her descriptions in the interview is all telling in terms of what this entire procedure means to somebody and what it's about. All right, so today I got the total surprise visit from Laura.
From Boston.
From Boston, yes.
We did a vertical restore, fat transfer, upper bleph, and a lower bleph, or skin pinches.
Yeah, amazing. And every time I see Laura, I've seen her a couple times since surgery. I saw her at the 1 year mark and now here. I'm always just blown away at how beautiful and natural she looks. But talk to us a little bit about what your experience with the whole surgery has been, whatever comes to mind.
Well, first of all, opting to have cosmetic surgery is never a choice to be taken lightly. But after extensive research, I decided that you were the guy. It was a choice that I'm 100% happy with. The procedure was fine. I mean, there was no pain afterwards. I did have a lot of bruising, but I'm that kind of person. Your office did send me all the prep stuff I needed for it to ensure a good recovery. No pain throughout the whole procedure. So you need patience with this, of course. There was swelling that went down, and over time it's gone down. And as you had said, it's going to continue to change with every month, and it has changed from the 6 month mark to the year mark to even the 1.5 year mark now. It's settled in quite nicely. My scars, I don't even see.
Yeah, we're going to take a close look at them in a second here.
Yeah, it's reversed it's given me back 15 years.
And how does that make you feel on the inside?
Well, having this done was really a choice. It was a personal relationship with me and myself, and how I felt when I looked in the mirror every day. And when I look in the mirror, I didn't see me. I didn't know who this person was anymore. So that's when I decided I'm having this done. It wasn't for my husband, it wasn't for my friends, it wasn't for anybody, it was for me. And I'm so happy I did it. Now when I look in the mirror, I feel energized again. I feel like this is me. This is the person that I've known for all my adult life.
Yeah.
And that's just a great feeling.
It is a great feeling. That whole look as young as you feel thing is a really real thing.
It's really true.
Yeah,
That look as young as you feel is the perfect way to say it.
Well, I mean, you look 100% natural. You don't look like you've had any work done.
No one has noticed.
Yeah.
No one. When I tell people, they're blown away.
And your kids and your family probably all are completely happy that you don't look like a different person now.
Yes,
You know,
because you can't see that
Yeah.
with some people.
And I should say, Laura is, I'm especially honored to have, she's an operating room nurse that was working with a very famous plastic surgeon who really wrote the book on neck work, Dr. Feldman in Boston. So when she chose me to do the procedure, obviously it's an honor. She's in the know, she knows what's up, and so.
And I saw his book on your back of your show.
Yeah, you saw that. Yeah, I've read the book. It was one of my foundational books, so major contribution. All right, so let's take a close look at the results here. So, what I always love to see is this beautiful, clean, jawline. And let's take a close look at all the incisions as well. So vertical restore starts up in here, comes down here, goes down here, goes behind the ear, and then back here. I mean, very, very nice, maintenance of the tragus. Let's look at the other side. The incisions all along here, all along here. We actually made hers in front of the tragus, which is a nice move because of this kind of smaller tragus. Down here, behind the ear, and along the hairline. Very nice. And as you can see, this beautiful shape of this jawline and neck. I love this kind of elegant look. And this is a 1.5 years out. And you've been using Trifecta since when?
Probably 1.5 years.
The whole concept is treat the skin, treat the shape, and then you put it together and you've got this person who really fundamentally looks young again.
And stay out of the sun.
And stay out of the sun, which is easier to do in Boston than it is in San Diego. But yeah, no, 100%. But that's wonderful. I'm so glad I got to see you again.
I know, thank you. And you're always so accommodating. Whenever I come into town, the office is always so accommodating for me to come in.
I love that.
That's great.
Perfect.
Thank you for staying so accessible.
Of course. All right, everyone. I hope you enjoyed that opportunity to kind of look behind the scenes and understand how I evaluate faces and kind of correlate the procedures with the changes that we're looking at. Remember, in a summary, vertical restore lifts the entire soft tissue. Upper blepharoplasty removes excess skin. Lower blepharoplasty removes excess skin plus a little bit of puffiness from the lower eyelid. Fat transfer replaces volume that has been lost as part of the aging process in areas like the temple, underneath the eyes, above the eyes, in the lips, and a little bit around the chin. And in every one of our cases, we try one way or the other to address the skin. And for most people, skin is a long-term journey. And in Laura's case, and in many of our patients, it starts with at-home skincare and sun protection and doing the right things over time. And you can really start to see the effects of the treatment start to build up over time. So that does it. I hope you enjoyed this. If you haven't already, make sure you subscribe to the channel as well as sign up for our newsletter if you want to hear more about this type of information and skin and overall anti-aging. The KaramMD Journal is delivered each week to your email. If you enjoyed the content, make sure you thumbs up and send it to a friend to share. All right, everyone, hope you enjoyed it. Thanks so much, Dr. Amir Karam.